Welcome back to TV5 News at 9. Today we are talking about breast cancer treatments with McLaren Proton Therapy Center. Joining us this morning is Dr. Hesham Gayar. Thank you so much for joining us.
My pleasure.
Okay, so this morning we are talking about how October is Breast Cancer Awareness Month, and we want to bring attention to this very important topic. So, doctor, when should women start receiving mammograms?
Usually, mammograms are critical for catching breast cancer early. And for an average woman that doesn't have breast cancer in the family, baseline mammogram at the age of 40 is not a bad idea, but must stop at the age of 45 for yearly mammograms. That's my recommendation. For women who have history of breast cancer in their families, then they should start earlier, definitely at the age of 40. But for any woman, it never hurts to have a baseline mammogram at the age of 40, and then follow up with your doctor's recommendation after that. If you feel any lump in the breast, please don't ignore it. Go to your doctor early, find out, because it could be life-saving.
And we usually hear, doctor, that breast cancer patients receive surgeries or chemotherapy to treat it, but what about proton therapy? What benefits does that have?
Many patients need radiation treatment, especially after lumpectomy. Radiation reduces the risk of the cancer coming back and help keep the breast intact without mastectomy. And often, especially in left-sided breast cancer, when the cancer is in the left breast, there's a high risk that radiation, even low doses, can get to the heart. And this is unavoidable sometimes with the regular radiation, with standard radiation. Proton therapy is very selective in reducing the radiation dose to the heart. It can be almost zero. So if you have breast cancer on the left side, check and see if proton therapy is a better treatment for you. Because even low doses of radiation to the heart can lead to significant ischemic heart disease and heart problems later on in life. This was proven, this is published, this is well known. And proton reduces radiation to the heart to almost zero, especially on the left side where photons cannot. So it has an advantage on left-sided breast cancer, and zero dose to the heart is unbeatable, and you cannot achieve that with conventional radiation.
Wow, and we also have a special guest here with us today. We've got Andrea Thompson, who's actually a breast cancer survivor. So Andrea, thank you so much for joining us this morning as well.
It's good to be here.
And so you actually had proton therapy. So tell us what the treatments feel like and if you had any side effects.
The treatments, I went in 5 days a week, Monday through Friday, and the schedule was fairly flexible, so I did it in the evening, which was most convenient, and the treatments are virtually pain-free. Everyone is very supportive and very helpful. You're basically, the treatment has been prescribed for you according to your doctor, and you go in each day. You don't experience any pain during the treatment. A side effect is that you have a minor, for me, it's very individual, but a minor sunburn that kind of progresses into a sunburn, and they're very helpful at talking to you about how to take care of that. So for me, it was wonderful. I didn't have lots of side effects at all.
Wow, that is so great. And Andrea, when did you finish your treatments?
I finished mid-February. I think it was February 14th.
Mid-February, wow. And what were the results?
I had a recent scan that indicated that there was no, I was cancer-free.
Wow, congratulations. We are so happy to hear that this morning. And
thank you.
I want to head back to the doctor just for a second. Doctor, how can people find out if proton therapy is the best treatment for them?
I think, as I said, it's always better to find out your options. If you have cancer, look for treatments that could be given in your case. If you wish to explore if proton therapy is good treatment for your cancer, let me repeat that. If you have with breast cancer, it's good to find out the options you have for your therapy, for your cancer. What is the best treatment option that is available? Especially for left-sided breast cancer, it's good to find out if proton therapy is a better treatment for you. Actually, for any cancer, if the cancer is close to critical organ, proton therapy could help. And the best way is to call us and ask the question. We'll be glad to see you, evaluate your case. Sometimes even before you come in, we can remotely tell you if it will help you or not. Call 855-MY-PROTON or look at the website at McLaren and find out, send an email or inquire. We'll be glad to help you find out if this is good for you or if this is something that can be explored, and talk to your physicians and work with them.
I am so happy that we're talking about this today because October is Breast Cancer Awareness Month. So it's very important information. Thank you both for speaking to us today. We're going to have that contact information along with more up on our website in the hot links section of WNEM.com.